Live from the Scripps Studios, this is 10 News.
The entire state of California has been ordered to stay home. Governor Gavin Newsom made that massive announcement tonight following similar orders in Los Angeles and the Bay Area. Now, this order does not mean you can't go get your groceries or your essentials. You can still go outside, just practice social distancing. It does mean don't go to the beach or gather in a group at the park. The governor said he wants Californians to help ensure their friends, their family, and neighbors comply with the order.
It's time for all of us to recognize as individuals and as a community, we need to do more to meet this moment.
Now, earlier tonight, Governor Newsom said that he expects more than half of all Californians to contract the coronavirus over the next 2 months. That is about 25 million people. Of those, Governor Newsom said about 19,000 will likely need hospital care. Our 10 News reporter Anthony Pura has more on how this order will impact San Diegans.
I spoke with State Assembly member Todd Gloria shortly after he got off the phone with the governor. He says that this is not an order that's going to be enforced by police. It's more of a social contract. It is uncharted waters for San Diegans, an order from the governor to stay indoors as much as possible to stop the spread of the coronavirus, though people can still go out for essential needs like groceries, medicine, and gas.
But otherwise, yes, you may go outside. You should walk your dog. You can get fresh air. You can walk around the neighborhood. People who do that, though, are asked to maintain that social distance.
Assemblymember Todd Gloria says the stay-at-home order is not a police matter. The governor hopes Californians will follow his order and that social pressure will help keep everyone in line.
No, I don't believe people will be going to jail if they get within 4 feet of one another. But it really shouldn't come to that. This isn't a time to argue, everybody. This is a time to be a good citizen, a good resident, follow these rules. This is not just for you. This is for all of us.
Gloria says for most people that have been following guidelines set by local officials, life shouldn't be too different. The biggest difference will be for people that work in what the federal government deems non-essential sectors. Gloria says essential sectors include the obvious, like police and first responders, but also many other occupations that provide important needs.
But this also does include grocery store workers, pharmacists, gas station attendants, car repair people, folks that keep the essentials of life going.
And Gloria understands that there might be some gray area when it comes to employees and employers. He suggests they go to the state website for clarity. Anthony Pura, 10 News.
Also tonight, San Diego Mayor Kevin Faulconer issued a statement regarding the governor's move. He says, quote, California must have a uniform approach to this health crisis so we can get through this together. Tonight's announcement by the state reinforced and expands upon all the orders the city and the county of San Diego previously put into law this week. All San Diegans should comply with this state directive to protect public health and slow the spread of this aggressive virus. Now, this order comes after we learned that San Diego County now has more than 100 positive cases of coronavirus. Here are the latest numbers. There are 105 people being treated locally for the virus. That's an increase of 25 just from yesterday. Most of those people are between the ages of 20 and 59. There is one case in a person between the ages of 10 and 19. But out of all of those 105 cases, only 13 people have needed to be hospitalized. And new tonight, we are learning 4 additional North County Fire Protection District employees, they have contracted coronavirus. They were in close contact with another employee who tested positive just last week. Now, the U.S. and Mexico, they are working on a plan to limit travel across our shared border. The State Department confirmed those talks today. The two countries are trying to place restrictions on non-essential travel because of the coronavirus. This comes a day after the president announced that the U.S. and Canada suspended all non-essential travel across our northern border. And a South Bay Council member infected with coronavirus is in the hospital tonight. Chula Vista's Steve Padilla's family announced tonight that he has been admitted to the ICU. Our 10 News anchor Lindsay Pena is in La Jolla with the latest on his condition.
Since being admitted to the hospital, the council member's family says he's asking everyone to please take COVID-19 very seriously.
I'm doing very well. I'm feeling well, thanks to the support of amazing healthcare professionals.
This was Padilla in a video posted to his Facebook page last week, announcing he'd tested positive for the coronavirus. Tonight, his daughter announced via a statement that he had experienced worsening symptoms and was admitted to UCSD Thornton Hospital ICU. The statement goes on to say that he's getting additional treatment, including a respirator to help with difficulty breathing. Padilla is a council member for Chula Vista's 3rd District, former police detective and former mayor of Chula Vista. At this point, it's unclear how he may have contracted COVID-19. Padilla's daughter Ashley passed on this message. Quote, "Everyone needs to take COVID-19 seriously. Please follow the advice of our public health professionals to reduce spread of the virus and take precautions to keep your families and our community safe." A spokesperson for Councilmember Padilla says they expect to have an update on his condition as soon as tomorrow. Reporting at UCSD Medical Center, Lindsay Pena, 10 News.
We do wish Steve Padilla well, but a great example of we must take this seriously. All right, the struggle to control the deadly coronavirus continues all around the globe, and life in America is changing by the day. Our 10 News anchor Kimberly Hunt has more on that for us as part of our efforts to maintain social distancing. Kimberly is joining us from home tonight. Hi, Kim.
Yes. Hi, Steve. And Italy has already surpassed China in the number of deadly coronavirus cases. And tonight they are desperately rushing doctors to the hardest hit areas as the number of new cases continues to spike.
We are in full emergency. Our health personnel, nurses, and physicians are working round the clock, countless hours to fight this incredible situation.
And as Italy struggles, new numbers from the CDC show nearly 40% of American patients hospitalized with COVID-19 were between the ages of 20 and 54, a sign this is not just an older person's problem. And while there is hurt, there is some hope. A drug used to treat malaria, chloroquine, is showing some promise, but the FDA is still studying the drug. And as the president commented on the drug possibilities, doctors today still stressed we need to follow instructions and help slow the spread.
I think it could be a game changer, and maybe not. But I think it could be based on what I see.
Right now, what most people need to know is we need to flatten the curve. We need to drive down that big increase, which unfortunately we appear to be beginning to see here in New York City.
And in New York, Governor Cuomo is now tightening the restrictions on businesses, mandating that 75% of workers must stay home. In Florida, the beaches are finally closing to force the spring breakers to quit gathering in large groups. And across the country, temporary medical buildings are being built as quickly as possible. Also, tonight, the State Department has a new warning to all Americans. Stay home and don't travel abroad. And if they're telling people, if you're already away, make plans immediately to return. Steve?
Kim, thank you. Life has changed for all of us, no doubt about that. All right, a new plan out of Washington may help boost the economy in the middle of this pandemic. Senate Republicans and the White House introduced the $1 trillion plan today. It includes relief for workers and small businesses getting hit the hardest. It will also include checks sent directly to Americans making less than $100,000. Anyone making $75,000 or less, they will get $1,200 checks. Families with a household income of $198,000 will receive up to $500 per child.
So I hope this bold new proposal will find a similar degree of bipartisan respect and mutual urgency.
The U.S. Department of Labor is asking states to hold off on reporting unemployment numbers since they are projected to spike.